Hi guys, how is the going? I hope everyone is doing fine. Welcome back to my video. And today's video, guys, I just want to say something, okay? I honestly want to appreciate our patients. Yes, today I'm talking about patients. So, if you're a nurse, especially who is working in a busy hospital, you will get my point and you'll understand what I'm talking about. Sometimes, actually, most of the times, a good percentage of nurses start the day with stress. They are stressed, they are overwhelmed, either the number of patients they are taking care of, either a lot of things they have to follow up, the the expectation the in charges and the team leaders, the superiors, they are expecting from them. So sometimes we have a lot in mind and we go through a lot. Most days we are stressed. So when we meet nice patients who are kind to you, understanding, generous, patient, and just caring, it's just a wow for the day. And you just feel like, oh my God, let this patient have a quick recovery. But at the same time, you don't want this patient to be discharged. Uh, a nursing career is very difficult, guys. Let me tell you the truth. It's not easy because you are taking care of different patients with different personalities and you have to meet their needs. At the same time, you need to prioritize which one is important than the other one, which one can wait. Something like pain, you cannot postpone. When the patient says she or he is in pain, you have to respond ASAP. Either give her pain medication. If she don't have a pain meds, call the doctor immediately for a painkiller. But sometimes, guys, we meet patients who are rude, honestly. As much as you say nurses, most nurses are rude, but also patients, my dear, you can meet patients who have attitude, who are very rude. The way they talk to you, you ask yourself, am I a professional nurse? How old am I? Like someone orders you around like a kid. So the way you communicate to this nurse really matters a lot. And if you want to have good time in hospital, please, if you're a patient, just be kind to everyone who is taking care of you. You never know if you need that person or not. Someone who is the housekeeper who is cleaning that floor, who is coming to serve you with food, please just be kind to everyone. Something might happen suddenly, and that housekeeper, that waitress, is the only person who was there. She or he is the only person who can save you. Go call a nurse or a doctor. Go check to that patient in room so and so. I think she's not okay. So just be kind to everyone. Kindness doesn't cost a lot. Honestly, it's free. And we are all human. We might not be perfect in one way or another, but we have to be caring for each other. So I have been a nurse for quite some time. For a few years I have been a nurse. And let me tell you, sometimes you meet a patient and be like, oh my God, how will I handle this patient for the rest of this shift? Sometimes you go to the room, you check on the patient, you say, hi, Miss So and so, how are you doing? Believe me, the patient will not answer you, and you wonder, are you the mistake? What have you done wrong? Just meeting with this patient or this client for the first time. You greet her or him, he doesn't respond. Okay, we understand everyone has a bad day, but now I'm just meeting you. By talking is half solving the problem. So when you don't answer or when you don't talk to me and you expect me to take care of you the whole day, it doesn't make sense. You are in hospital. That's why I'm here to help you. So you might be having a bad day. You are unwell. You are maybe totally sick. We understand sometimes people have mood disorders. We call them mood disorders. Sometimes they are extremely sad. Sometimes they are happy. Yeah, we have such people. But until you talk, until you share with me something, is when I understand maybe there's a problem. Maybe you need a psychologist, maybe you need a psychological review, something like that. And let me tell you, you're gonna meet these sweet patients who are bubbly, who are jovial. And by the way, me, I love such kind of patients. When I go in the room, we are free to talk like sisters, like how is the going? Tunapiga story one on one, you get. So I just wanted to appreciate all good patients out there. You guys, sometimes what we only need as nurses, it's a simple thank you. Oh my God, it makes us feel so good. Or sometimes you attend to a patient, she's telling you how happy she is with the services. She's telling you, oh, thank you so much. You really do a lot. Like just an encouragement or something, you know. We have a lot of pressure, you guys. You don't know how much we go through. It's not an easy task. Let me tell you, bedside nursing is not easy. Yani uko na vitu mingi, vitu mingi, na hiyo vitu mingi you need to document. Hiyo vitu mingi you need to document, you get. So, sometimes we are just super overwhelmed. It's overwhelming, you know. And when you just take care of a patient and she feels appreciative, she feels like, oh my God, you have just done your best. Like it feels good. It feels good. I had there's a day I was just going around, yeah. Then I met this patient on her bed, yeah. Uh, for those who don't know me, I work in maternity, okay, in labor ward. So this patient looked in pain. The way I was looking at her facial expression and everything, I could tell she was in pain. And I was like, hi, Miss So and so, how are you today? You look like you are in pain. Are you okay? And she's like, yeah, sorry, sister, I'm in pain, but I don't want you to bother you so much. Sitaki niwasumbue. If you're not busy, can you please just give me painkiller? I felt like this mama is, as much as she's in pain, but she's caring. Maybe she understands our work and how it is. Maybe she understands the type of, you know, the workings and the rounds we do, especially in busy hospital, in busy facilities. Achana na hizo clinics za outpatient. When you go in any busy facility, guys, you understand what I'm talking about. Nurses are always on toes. Na wakikaa, maybe they are documenting what they have done for the day, you know. So she was like, I don't want to bother you so much, but I'm really in pain. And I'm like, I'm so sorry, ma'am. You could have told me earlier. You could have ring the bell, say that you are in pain. You don't wait for pain, you know. Ukiwa in pain, just ring the bell, we give you pain medication. That one we don't postpone, you know. Sitaki kuwasumbua sister. Unajua naona tu kila mtu ako busy. So naona, I thought it will be okay. Nimejaribu tu ni rest, nione itaisha lakini haishi. This mama was sweet. She was understanding, by the way. I went and gave her painkiller. Imagine namdunga and she was like, thank you. Hata pain haijaisha, but she was so great. I felt so good, by the way. And I told her, the way you just approach these nurses, it really matters a lot. You will meet another patient who is totally opposite, you guys. Totally opposite. Let me tell you. So, in another case, you will meet a different patient who is also in pain, yes. You say hi to her or him, he don't respond. It depends on the level of pain, how much the pain is, and we normally rate it from 0 to 10. So you ask your patient, how are you doing? She don't answer you. Then the next question will be, kwani huku painkiller mnapeananga saa ngapi? Mara ngapi kwa siku? Nimeshinda kwa uchungu. Nimeshinda kwa uchungu. Honestly speaking, I'm not an angel sometimes. I can tell you are in pain, but sometimes just do me a favor. You just ring that bell, call a nurse to tell her politely that you are in pain and you will need some pain medication. So when you approach me in such a high tone, you are so mad already. How do you expect me to answer you? Okay, I'll just say sorry. Sorry for that. I didn't know you are in pain, but I'll give you your pain medication. Maybe you come with tablets. Maybe she's on oral medication. You give her tablets. And she's like, kwani si injection tena? Is that who has inside? Guys. Oh my God. I need an injection. And maybe this is the patient who is awaiting for discharge. Oh my God. That's why I love bedside nursing. Because you will meet these different personalities. And sometimes I'm like, oh my God. Nicheke ama nifanye nini? You even confused. You don't know what to do. And you'll be like, these are the medication you are on now. You are on oral medication. The doctor stopped the IV and the injections. Kwa nini alistopisha? You know, I need that injection. So you need to go hustle, talk to the doctor if you can do an injection start or something. The doctor authorizes you for an injection. You come back with an injection, okay? Unataka kumdunga, munaanza drama. So you come with that injection. Of course, everyone has phobia of injection. I'm sure. Almost everyone. So you start disturbing again. Nataka kukudunga. Wait. Is it painful? Wait, I have to turn. Let me go to the washroom. Let me empty my bladder. My God, you are taking a whole 20 minutes, you know? To reassure this patient so that you can give an injection that she has requested for. Where? Anyway, my point is, if you're a nurse and you meet such kind of patient, and you will always meet them, just be patient with each other. Just understand your patient the way she is. But be careful not to be rude to them, because at some point that's where they push you to be rude to them, you know, to talk to them. Sometimes you can be impatient. We are all human beings, guys. Even nurses, we are all human beings. We have our own weaknesses. We can lose our temper easily. When you meet such a patient, you can start exchanging words, which is not professional. Just walk out if you think things are so hard for you. And when you walk out, it's also a sign of rudeness. Na namwongelesha na anatembea anatoka. You know, just walk out. Take deep breaths. Just know that it happens, and you will meet such kind of people. Talk to your team leader, your superiors, you're in charge about it. Yeah, don't ever exchange words with your patient, because sometimes we understand they go through a lot. They are unwell. They have so many things going through their mind. They have maybe family issues, financial issues, and here come they are unwell or they're sick. So sometimes I try to understand them, but at the same time it's so hard to to understand such patient, because I'm just here to take care of you. As much as you are stressed, I'm here to take care of you. I mean no harm, you know. Funny thing with these patients who are always bitter, when you go in with the doctor, I'm telling you, the way they are so excited, the way they are bubbly. In fact, they're the one who welcomes the patient, who welcomes their doctor. Oh, hi doc, how are you? How was your day? Mi aki niko poa. Tunang'ang'ana tu hapa, though sijapenda services, but tutafanya nini? I hope you are discharging me today, doc. I was about to call you. Yani, the way anaongea. Nikama, alafu is the same patient mwenye umekuja like few hours ago. She's not talking to you. Aki unashangaa kabisa, unashangaa. And patient, you need to understand that nurses are always there for you, always there. That's why the doctors are always on call. Mmeona nurses on call? The doctors are always on call. They come when it's necessary to come and see, when it's necessary. Yeah? Nurses are always there to make sure you are comfortable, to respond to your needs. Like wish mungejua. Yeah? You could just respect nurses. And respect is a two-way thing. Nurses also, we have to learn how to be professional to these patients. Yeah, if you're professional to the patient, of course, ataona kweli, I'm dealing with someone who is also treating me with respect. But if you go there with your rudeness, of course, what do you expect? So I did not want to talk this much, by the way. I did not want this video to go beyond 5 minutes. But anyway, guys, let's just be good to each other. Especially, let's strengthen that bond. Let's have this peace between a patient and a nurse. That capiz too. We need that capiz to be there so that everything to run smoothly. Don't be a patient who is always looking for something wrong in this person. You know, huyu nurse kwani hajabisha mlango, huyu nurse kwani hajanisalimia, huyu nurse let's not blame each other. Where you see something is wrong, please, in a hospital, any hospital you go, there's either a team leader, an in charge, a superior nurse. Just let them know your complaints about maybe you are not comfortable with the services of this nurse. Maybe you feel this nurse has attitude, the way she's treating you, she or he is treating you. It's important to raise your concern so that we know where the problem is. Okay, otherwise, we love you so much, and thank you for being nice to us, for those patients who are so kind to us, for everyone. Let's strengthen the bond. Let peace prevail for the services to run smoothly. Otherwise, I'm always proud of my career, of my profession. And next time I'll talk about the relationship between nurses and in charges, our bosses, a relationship between ourselves, amongst ourselves. Kuna two issues, guys. And yeah, I'll talk about it. Honestly, thank you for the support. Thank you for watching my videos, guys. Thank you for the love. Make sure you subscribe to my channel, share with your friends, and I'm always grateful, guys. Thank you for watching. See you again next time in my next video. Bye, guys.